Hello, everybody. This is me, Amin,
And this Alex.
and welcome to another episode of Let's Talk About. So this is Let's Talk About at home, kinda. So Alex is at home. I'm in the studio all alone. We're doing this because it's EMCO, and we're trying to be safe and we're trying to be responsible. So in this episode, we're back to talking about COVID again because we need to move on. We need to stop the spread and recover soon so that everybody can get out of their houses and start living normal lives. But that's not the case right now. So we're talking about COVID again because it's been 6 weeks since all of us have been at home. It's been like a couple of weeks of EMCO, and cases are rising with everybody still at home. When is this going to stop? Where is the light at the end of the tunnel? So a bit of context. Today is Friday, the 16th of July, and we're talking about this because we got like a number of updates. Today, I saw a news report saying that the Deputy Prime Minister and also the Minister of Defence, Sabri Yaakob, said that the country is considering to move to phase 2, which means less restrictions. No need to stay at home so much. You can probably do recreational activities. More shops should be open in early August. But cases are rising. So yesterday cases was 13,000. I don't know what the numbers are today. Alex, do you have the numbers today? Or they haven't come in
Today,
yet?
it's not in yet.
So we're looking at probably another 13,000 day or 15,000. But on the flips, ICU beds are still at full utility. But on the flip side, we are also hearing a lot of this, I wouldn't say positive, but a lot of this encouraging news. Like, was it yesterday that Dr. Hisham said that the cases are going to drop as vaccination rates increase?
Yeah, he said you can foresee that the cases will go down soon as we ramp up our vaccination. Because right now, as of today, we are doing 4 days of more than 400,000 doses in a single day. So that's an encouraging sign.
Okay, so then let's look at the numbers, right? So cases are rising. We saw for over 3 days, cases have been over 10,000 cases in a day for over 3 days. Selangor is still racking up the highest number of cases. But at the same time, we are also vaccinating more people nowadays, and we're apparently testing more people nowadays. But on the other flip side, we're seeing positivity rate also increasing. There's 10% now, Alex?
Also 10%, about 8 to 9%. So on 13th July, we tested about 131,000 people, and the positivity rate is about 8 to 9%. That's a lot, and that shows that we still need to do more tests.
So what is after EMCO? Are we ready to open up our doors? Do you guys want to open up your doors? I mean, what do you feel? I mean, to our readers, viewers and listeners, put in your comments. Let us know, what do you think? I mean, should we open up in early August? Things couldn't get any worse than this. Like, is this like the ultimate worst that it could get, and it's only going to get better? What do you guys think?
Okay, for me right now, I think the best way to get out of this is if we ramp up our vaccination rate. Because if more people are vaccinated, hopefully we'll see reduction of people getting infected, less deaths, and also ultimately most important is to have less people getting hospitalized. Because the biggest problem right now is that our hospitals are full. I'm pretty sure you hear a lot of stories about healthcare workers are getting worn out. They're getting they're getting demoralized. They're seeing people, unable to get the treatment they deserve. We've seen photos and videos on social media where there's not enough beds, and you can see them making makeshift beds at the car parks, at the emergency departments, at hospitals.
Yeah.
And it's like, you can't imagine this happening in Malaysia, because we've seen this in countries like India, and we thought, okay, you know what, Malaysia is much better. We can do this better than other countries. But it's happening right now in Malaysia. So it looks very discouraging. And if you look at the National Recovery Plan, there's 3 criteria that we need to fulfill in order to move to the next phase. Like you mentioned, that we have less restrictions, more shops can open, certain social activities might be able to be allowed. And to achieve that, we need to hit 3 things. Number 1 is to have 10% of the population vaccinated, which we've already done. Secondly is to reduce the number of cases to below 4,000 cases in a day, like what we talked in the previous episode. And the third one will be to make sure that our ICU capacity is in a moderate level. Right now, looking at the numbers, our ICUs are full. We're hitting like 900 cases. Yesterday, I think we hit about 880 ICU cases, which is still high. So at the current moment, I don't see any reason for us to loosen our restrictions. But at the same time, I think the vaccination program is doing pretty well. I think we make significant progress in terms of vaccination numbers. Last 4 days, we're doing more than 400,000 doses per day. In fact, yesterday, we hit a record high of 460,000 vaccinations per day. That's like one of the highest in the world right now. But then again, we are still far from the finishing line. So I think as of today, we only got 12% of the population vaccinated. If you ask me, can we open in August? I can't answer that because the ICU beds, like you point out, is still full, and we still have lots of people to vaccinate.
Yep. So while we have a record number of vaccinations going out there, we also have record number of cases, and we have record number of people in beds. Let's not even talk about ICU. Even hospitals are full. There were talks about putting people who are not critical cases to shift to private hospitals. There were discussions about that. We talk about the hospital in Kelang, the hospital Tunku Ampuan Rahimah, that's been full and inundated with cases, over capacity. Even the people who are there, the health workers, are not able to cope. It doesn't make it better that certain quarters are trying to downplay that case. Certain quarters are trying to say that that's fake. It's what you see on social media is not correct. There were also reports that the people who are working at that hospital have been given a directive not to share the hospital conditions on social media. I guess that tries to play on people's fears, and they're trying to say like, okay, you know what, things are under control. But to be honest, and I've been to one of the busiest COVID assessment centers in Selangor, the one in Stadium Malawati. And the first time I went there, when I saw the real situation, I saw hundreds of people lining up outside of the stadium trying to get assessed. And these are people who are already positive. It scares me because and I see people coming by the busload. It scares me, and it seems like there's no end because there are schools are not opening. I think kids have now wasted 2 years of their academic year not studying. That's school children. Let's not even talk about people who are in universities. Let's not talk about even like how many lives have been destroyed by people who've been committing suicide. Number of suicide cases in the country have increased. Probably due to what's going on in the country today. We see death cases increasing. Yesterday it was over 100, right? I mean, the situation is dire. Yes, I feel like there's a lot of people who want for the country to be better, and like you said, Alex, right? Vaccination rates need to be increased, but I don't know if they can increase any further. I think the government is, again, credit where credit is due. While the vaccine situation was terrible at the start, and it didn't get better in the middle, it's now becoming more smoother and becoming more efficient. I was skeptical that we will never hit 300,000 doses a day. Back then, we were struggling to meet 100,000 doses a day. But now we're doing 400,000 doses a day, and that's amazing. On the flip side, we need to test more because our positivity rate is still high. And yeah, like you, I don't know whether we can open up or we can lessen the restrictions by August. Why do I say that? Well, let's look at countries that's already returned to normal. If you're a football fan and you follow Euro 2020, you can see how people in the UK and in Europe are watching football at a stadium like there was no COVID. If you look at the US, things are almost like normal. Then you go back to like, okay, how did they get there? What is the vaccination rate there? So what are the numbers there, Alex?
Like you mentioned, right? Like UK and US, they're like the worst hit countries. It's like those are countries we shouldn't be, back then because we are doing so much better as Malaysia. But look at UK right now. UK, 70% of the population have at least one dose. About half of them are fully vaccinated. In the US, it's similar as well. About 56% of the population got the first dose, and 48.5% have their second dose. They are fully vaccinated. So I guess that's one of the reasons why they can go back to normalcy, because at least half of the population have gotten vaccinated. Whereas in Malaysia, we are about 12.5. So we still have a long way to go before we aspire to be as open as the US and the UK. And also adding on to that, right? So I think there's a few pillars here that we need to look into. Number one is vaccination rate. Yes, high vaccination rate is one of the ways for us to go back to normal. But at the same time, we need to increase our testing capacity, because we need to track cases and to isolate them as quickly as possible. I don't think we are doing that right now. As you can tell, our positivity rate is quite high. And to give context, right, Singapore is doing about 90,000 tests per day, and they got about 15 to 35 cases daily. So at least they're doing that check every single day to ensure, okay, are we okay? All right, we are still fine, because we have less than 5% in terms of positivity rate. At the same time is, how do we decrease the number of new cases? Just because you have high vaccination rates doesn't mean that, okay, it's okay, we can let people get infected. No, we can't. We need to cut down the number of cases. And the funny thing is, in May 2021, Dr. Noor Hisham said that daily cases could reach 13,000 if SOP non-compliances continues. And here we are, 13,000 cases. The EMCO, or the total full lockdown, that was intended to bring down the cases by locking down everyone so that people don't move. Factories shouldn't be open, industry shouldn't be open, so that we all stay at home. Like the very first MCO, to bring the cases down, to give some pressure relief to the hospitals. But turns out that it's doing the opposite. ICU beds are still more than 800 cases. And in fact, right now, the active cases is more than 100,000. So what went wrong? And I think all of us agree that this total lockdown is not really a lockdown, because the moment they announce the restriction, there's always another opening at the side. Okay, lockdown for everyone except, okay, you can open. Okay, you can open. You want a meteor letter? Here you go. So, what are we doing here?
We're just locking down people who are not contributing to the number of cases. I think to sum it up, right, the situation is out of control already. The number of people who are infecting more people is runaway. That means you cannot stop that train. And the only way to control this is through vaccination. So for us to hit that 50% target, right, if we are doing 400,000 doses a day, how long will it take?
If we do, let's say we're doing 450,000 doses per day, 1 month, that's about 13.5 million doses. So it's about 6 million people fully vaccinated each month. So in 3 months' time, hopefully by September, we should get at least maybe 22 million people vaccinated. We are quite close to 50% by then. Yeah, quite close to that. Yeah. And that's assuming that more people register. Because I think there's still a couple of million people more who have yet to register so far. But at least if we get 50% mark, I think we can see some substantial improvement in terms of the number of cases, the number of hospitalization, and number of people in ICU. So if you look,
Go ahead.
So in these 3 months' time, what should we do next? Should we loosen restrictions? To me, I'll say no. Let's not risk more people's lives. Let's continue to lock things down and really lock things down, because obviously the contributor cases are coming from industries that are permitted to open. Like, why are they given the leeway to open and causing more cases, whereas the rest of us are staying at home?
Okay, as it stands, 70%, almost 80% of the country's population have already registered for vaccination. I think the remainder, 20 plus percent, yes, there is a concern, but we have to focus on people who are already ready to get vaccinated. And the concern here is that people who are already ready to get vaccinated, even that is an issue. While they are ramping up the number of vaccination, there are people who are waiting in line, who haven't yet even gotten an appointment for their first dose. So I guess if we look at the situation right now, okay, I don't think there is anything more that we can do to bring the cases down. I think we have to assume that everybody has COVID. The only way to save the country right now is to get everybody vaccinated. I guess lockdown is important so that we don't spread it to more people if we can, because every time, if you notice, like every time the virus gets transferred to somebody else, it gets copied, and that copy risks mutating the virus. And when you mutate the virus, you have these different variants, like the Delta variant that's very popular now, that's very infectious or very dangerous or very whatever it is, right? I don't know. For me, my opinion is, yeah, if they want to open up by August, they need to do it smartly. I mean, we have a substantial number of people who are already vaccinated, and I think it's good to have them open up. At least the economy is not stagnant. I mean, I drive to the office today. When I see the traffic on the road, it's like normal. It's not like EMCO at all. So I guess opening up can help, because we have to balance, right? We have to balance between saving lives and also saving the economy, because the suicides and all that are also costing lives, right? Opening up the economy might alleviate that pressure and might save more lives, might save people from abuse, might save people from suicides, from mental anguish. So there is a balance. But I'm not sure whether the government is considering all this lah. For me, the simple answer is, when I see what the government is doing, is only to help themselves. If I can say that. I mean, we have reports of ministers going on holiday. We still haven't gotten answers why factories are allowed to be open. We still haven't gotten answers why Parliament is not open. And then conveniently, there is apparently a case in Parliament. I mean, why can't Parliament be digital? Why can't we still run the government in a digital way? I don't know. I guess we're digressing, but to me, all of this is related. If we have a competent government that's run by competent people, we probably wouldn't be here in the first place.
Yeah, I fully agree. Like, for example, it's all about priorities, right? Like, for example, okay, economy, I think all of us agree that it's important, because we're going to lose billions a day if we close down our factories. So we started this EMCO or total lockdown, like, when was it? May, I think. So when we did that, right, they should focus immediately on the industries. Like, for example, okay, let's vaccinate the factories first. If you reach a certain target, like 70% of the factories or workforce are fully vaccinated, you can open. If we did that in the first place, right, then we would have factories that are allowed to open in stages once they hit the vaccination threshold. Because if they are fully vaccinated, and if they do have an outbreak of case in the factories, at least they are more contained. I think most of them will have like stage 1 or stage 2 symptoms. And this will reduce the number of people getting into the hospital. Because you think about factories, right, you're not talking about the companies itself. Think about the livelihood of the workers and the families. Because imagine you get an outbreak in the factory, you're going to bring it back. You're going to spread it to your whole family members. Then you have 5 or 6 cases at home. So when we had the lockdown earlier on, why don't we emphasize the vaccinations for industries first? But at least, okay, luckily we managed, I think the country realized that a bit later. In fact, in June, we started phase 4. That was just announced recently to vaccinate the industry. But again,
they suddenly created phase 4.
Phase 4, yeah. I mean, that should have been started from the start, right? Like, ask me, at least you would tell KJ, hey, dude, I need to open my factories. Can we vaccinate guys first? All right, let's put factories as phase 2 or phase 3 or something like that.
Yep.
And at the moment, factories are still open, whether you're vaccinated or not. So why not make that an enforcement in the first place? Like, okay, factories close it until you vaccinate, let's say, 70% of workforce. Then you're allowed to open.
They're doing that now, but it's already, I guess, too late. The cost of people, again, mental anguish and lives has already been done. It's easy for us to say that, okay, in retrospect, this is how it should be done. But we're just normal people. I mean, the people who are in power, the people who are in government, the people who have the data, who have the means and the capacity to make this happen, should have made this happen. And, I hold them accountable for this. In any case, if we are going to return to normal in early August, my suggestion would be that, right? So people who have already been fully vaccinated, like yourself, Alex, you have the digital cert, right? So they can have all these strict roadblocks. They can have all these MySejahtera scans in front of shops and all that. And it's very simple now. All they have to do is have somebody there to verify whether you have a digital cert or not. If you don't have a digital cert, you should be at home. For me, that's the only way to make this happen. Because we have to look at the sectors that have been severely impacted. They have not been functioning for 2 years, right? For almost 2 years. The tourism sector, the schooling, the tourism sector and and all of the sectors that have been supporting the tourism sector have been severely impacted by this. So I can understand And again, I don't agree with the government. I don't think what they're doing is right, but I can understand the need to open up as soon as possible. And if they don't say how they're going to open up, and they don't put out a proper SOP on how they want to open up, it's going to be confusing again for everybody, and we're going to start from square one again. So for me, my suggestion would be that, right? Use the digital cert as an internal passport for everybody, and only allow people with the digital cert to go out. And strictly comply to that as an SOP. No more lobang. No more like, okay, there's an exception to the rule or whatever. For those who don't have it, then I guess it's up to not up to the government, but it's on the government to start introducing the walk-ins, right? So there's been report that they're going to introduce walk-ins for 60-year-olds and above. I mean, they've learned this from before. They shouldn't do this segmentation from the start. They should just allow everybody to go in and do walk-ins. What's the problem with that? Why now? Okay, still segregate. Only 60-year-olds can do it. Why not everybody do it? Is there a problem if they allow everybody to do it?
I think it's more on crowd control, because if you let everyone go in without appointment, then what happens if, let's say, a PPV doesn't have enough vaccines? For example, you only have 4,000 a day, and you let 10,000 people show up on that day. Then you have crowds and disappointments.
I think Malaysians, right, we're so good at that already, right? We're so good at lining up and queuing up, and because we do all these crazy sales, right? So we know, and we can learn from Japan. We can learn from countries that already do this very well. You can do either a raffle system, right? You can have the slots open in the morning. You can say, okay, today we're expecting 100,000 doses from this facility. Come, get your number. Okay, you got your number, you can go home. Then we will tell you, please come within an hour or within 3 hours when your turn is up. It can be done. I'm not sure why the government is not thinking about this. I mean, we can innovate. There's so many systems than just standing in line under the hot sun, like the CAC in Malawati, inshallah. They can do it. But why are they not? It's just for me, the root cause of this is incompetence and poor coordination among all of the ministries.
Okay, for me, I would say the appointment system for all the issues, right, it works. As in, like, from our experience, right, once you get appointment, when you get there, you don't spend more than 1 hour. You're in, you're out, done. I think it works. But the problem is the system is not fair to everyone. Like how we mentioned that some people are not getting appointment, there's no visibility. If those issues are sorted out, I think the system is more than capable enough to handle mass vaccinations. The problem is there's no clarity.
No, the question is right now, why is it taking them so long to fix that system? It's been since February. MySejahtera has been used for over a year, right? We used MySejahtera for vaccination in February. Now it's already 5 months, right? And it's still not fixed. There are still people like Rory, Marcus. There are still people like Munira. They still haven't gotten their appointments yet. They've registered since February, and I know people who've reported to me that they've gotten vaccination, but it's not reflected on their MySejahtera. All these weird problems come up. So if they cannot depend on MySejahtera, or they cannot fix MySejahtera, then what? Make vaccination centres independent lah. Just send doses to vaccination centres and let them arrange how they do it.
For me, the way I see it is, okay, I agree that the first phase of the program, I think the appointment system is important because that time we have limited number of vaccines. But now we reach a point that we have a lot of vaccines. I think starting from this month onwards, we have 14 million doses every single month. That's why we can ramp up vaccination rates. I think we reach a point that I think most people will have their vaccine doses. And I think that's probably the reason why they're opening up for walk-ins for senior citizens, because we reach a point that most people who are waiting for vaccines, they got it already. Now, how do we reach out to the final people who are hard to reach? Or there's something wrong with the app for them?
Okay, I don't know about you guys, listeners and viewers. What do you guys think? I feel like there is a hesitancy among, I don't know, again, in the system, the JKJAV and the CITF. I feel like there is a hesitancy. Like you say, and we talked about this, right? There will be more vaccine doses than people who are registered by the time we hit August. And I think we're kind of like on the mark there. There's a lot of vaccines. The vaccine supply is in abundance in Malaysia. We have vaccine supply that we ordered. We have vaccine supply from people who donate. There's so many vaccines. Yet, why are we not opening up? Why is walk-in slow? Because the people, okay, I think the people who are doing the JKJV and the CITF, right, they can correct me if I'm wrong here, but they can already predict, right, okay, we're getting X amount of vaccine by when. You can already plan. Okay, if I know I'm getting a huge supply by July, I can already talk to schools. I can already talk to places of worships. I can already talk to community members. Guys, we're going to just issue you doses. We're just going to inject. Are you in or not? Make it happen.
I believe that's been done already. That's the reason why we're hitting 450,000 doses per day. Because at the moment, there are actually more participation from hospitals and clinics. There are more outreach programs. There are more mobile clinics. There's more drive-in PPVs as well, especially throughout the country. There are also on-site vaccinations as well. So I think those things are in place already. That's why we're seeing high rates. Because previously, I think last month, we had a different issue. We have issue with Selangor saying that, Selangor has a lot of doses, but they're not injecting fast enough. And what's the reason why we're not vaccinating these doses? Back then, the concern was we have surplus of doses, but you're not using it. What's going on? Why is it slow? So I think that has been addressed with more PPVs. And that's the reason why we're hitting 450,000 doses per day. So I think that's been solved. So in terms of walking in, I agree that last time we should have been done to address the issue, but I think that's sort of addressed at the moment. That's the reason why we have high vaccination rates today. Now is how do we, expand to the final, I don't know, 10% or 30% of people who have not gotten the jab yet. I mean, registration yet.
Okay, I don't know whether we should put a lot of effort in the final 10% or 15% or whatever it is, right? My concern is that the walk-ins, right, it's still not activated yet. KJ said, was it yesterday? So again, this is the 16th of July. I think it was yesterday. We saw the news report where vaccination will open up for walk-ins for 60-year-olds and above. And then that report came in, and then I think he had to clarify to say that, oh yes, that's going to happen, but it's not going to happen now. We're still considering it.
You need to think about logistics though. So like, for example, if right now all the vaccines...
No, that's what I'm saying. In terms of logistics, right, they have time already. They have time since when they know the supply is coming to when they can announce that walk-in is possible. They have time to think about that already. What more do they need to make this happen? What else? Where is the bottleneck? Be transparent and tell us where is the bottleneck. Don't come up and say that, oh, we need time to think, or we are still considering, or we're still looking at the feasibility of it. Because you can learn from the whole world, and the critical factor right now, despite the number of cases, despite the number of ICU beds, the only hope that we have is vaccination rate.
Yeah, and that's also a target. They aim to vaccinate all senior citizens by end of this month. So they have 2 weeks left.
So I don't know what's going to happen in 2 weeks. I know that, today is supposed to be the last day of EMCO. So probably by today's press conference, he's going to announce that it's going to be an extension.
Hopefully. But I don't know what difference it's going to make. Because I don't know what difference it's going to make. Extended or not, what's the difference? Because at the end of the day, majority of us Malaysians will be staying at home, and the industries are still allowed to operate. So, and I don't see how is that going to help reduce the ICU cases. I don't see how it's just going to reduce the total active cases, because this OEMCO has not been effective in reducing ICU cases. We're not giving the medical system a break. So that's my biggest concern, the hospitals. Because it's not just about COVID cases. Even other critical cases that are non-COVID are affected as well. They don't have ICU beds. They don't have enough manpower to treat other diseases. So at the end of the day, it's not just about COVID deaths. It's about other deaths because they can't be treated. And also one thing we forgot to mention is that there are more brought-in deaths. Means people who died at home because they couldn't get treated in the hospital. And that's sad.
Okay, I guess, on that note, we started the show with the question, what next after EMCO? So I guess it's just ramping up in terms of, it's just ramping up vaccination rates. From our discussion, I guess we both of us can agree, right, Alex? The number of cases is out of control. There is nothing else that we can do to, aside from closing the factories and whatever. It's too late for that already, because it's already in the community. We assume that everybody has it. if you close the factories now, it's already too late. It's not going to make much of a difference. The only thing that's going to make a difference is vaccination rate. So I guess the only question we have now is when is the government going to start opening up to walk-ins? Because we have enough doses and we have enough people that want to get these doses as quickly as possible. And if the government is going to open up by August, again, my suggestion is have strict control and have proper control of how people use the digital passport. And, hopefully that can help bring the cases down.
Yeah, on that, I want to add also, like, for example, in France, what my friend shared to me is that because I think they vaccinate most of the people, so how they get more people to get vaccinated is they come up with a new policy. I think by end of this month or next month, those who are not vaccinated are not allowed to ride public transport. So because of that, right, there's a mad rush of people getting vaccinated. So maybe that's one condition to get set. Like if you don't have digital certificate, you can take the train or you can dine in, you can open a shop. And only businesses that fully vaccinate their staff are allowed to open.
And no more exceptions or side doors lah. I mean, we can make it happen and we did it before. Here's the thing that frustrates me, right? We were better than even the most developed countries in the world because we were strict with ourselves. We closed the factories, we closed everything. And then the politicians come in and screw everything up. All these factories that are open, I'm sure it is because of some interest involved. All these side doors that are open, I'm sure it's because you have cable or whatever. So if now is our second chance, having even 10% of the population vaccinated and you want to open up, I think it's fine. But please, be fair to everybody and have one law for everyone. Okay, everybody, it's that part of the show again where we read and respond to your comments. So in this episode, we're responding to the comments from our previous Let's Talk About, which is Let's Talk About number 70, where how can Malaysia bring COVID cases down? So I'm going to read this comment from Azim Hamidun. He says, memanglah tak turun. Targetnya population untuk vaksin ni lari. Orang yang kerja dari rumah dah sampai 2 dos. Yang kerja luar, yang kerja kilang, foreigner, semua tak vaksin lagi. Memang out lah. Okay, Azim, you're absolutely right. I think we talked about that in this show, in this episode also, right, Alex? Like, they should focus vaccination on the people that are spreading the cases, the virus the most, which is factory workers and those other industries. Yeah, they should do that.
Yeah, I mean, during the lockdown, right, should take opportunity to lock everyone down and vaccinate them. And only those who are vaccinated that are allowed to open. They should do that.
Yeah, they should. Okay, move on to the next one. Ken Lu, he says, Sabah election, the catalyst that started it all over again. Well, it is true and it is not true, right?
I disagree with that. Okay, while we can't deny that Sabah election has caused a surge in the country, that's where Sabah really got really bad. And then there's a lot of mistakes back then. Because, like, for example, after the election, they reduced restriction. Like, when you come back from Sabah, you don't need to do any quarantine whatsoever. Yes, that caused a spike. But I don't think that's the reason why we're here. Because after election, I think there's a lot of mistakes on the way. Like, I think in December, we opened up travel for interstate travel. When the cases are going up, we open up travel. So that's nothing to do with Sabah. We open up more opportunities for the virus to spread. And then the recent situation right now, I think there's a lot of missteps right here. Like, for example, when the cases go up, instead of tightening restrictions, we open up everything. We're locking up businesses that are not contributing to cases, and industries that are actually creating the clusters are allowed to operate. So it's like counterintuitive there. So if you ask me, Sabah's not the cause. Yes, it did a surge, but the current mistakes are done by the current situation right now, which basically Malaysia never learned its lesson lah.
Yeah, so there was a mistake made with the Sabah election. Should it have been gone through? No, it shouldn't. But is the situation now is the Sabah election the cause of where we are now? Definitely not, right? So we've made a number of other missteps on top of the Sabah elections to put us where we are today. So congratulations to the Malaysian government for being consistent in making mistakes. All right. The last comment is from Lily Chang, and she said, This is a suggestion. So she said should also do drive-through vaccine. Jab first, register later. Plus, go and vaccinate all factory workers. Instead of discussing who to pay for the vaccine, just jab first on site and find ways of recovering money from employees later. Yeah, I think that's a really good suggestion. I think we covered that in this show as well. We should just go out there and get people vaccinated no matter what. Just get them vaccinated. In fact, I think there's a lot of funds that we already have available, right? That Pemulih thing you mentioned just now, Alex.
Yeah, there's a lot of formulating, to help SMEs, to help businesses to weather the storm. So instead of while it was good to like subsidize wage and all that, they should put more priority in vaccination, because if more people are vaccinated in the industries, then we have less severe cases, and that will actually put a huge relief on the medical healthcare system. So it's sad that they become to this situation. Like, we should just jab everyone first, like what Lily said.
All right. I think that's pretty much it. So yeah. That I guess that's the time for me to remind you, okay guys, sorry, because this situation of me recording by myself and Alex on the other side at his house is very weird. So yeah, this is the opportunity for us to remind you that we're also available on podcast. So if you prefer, you can listen to the show Let's Talk About on podcast. We're available everywhere that you listen to podcasts. So all you have to do is search for Sorry Chichao Let's Talk About, and we're there. If you're listening to us on podcast, please do give us a 5-star rating if you like the show, because that helps more listeners have a listen to our show. At the same time, if you're watching us on YouTube, please do give us a thumbs up if you like the show. Don't forget to subscribe to the channel if you haven't already. And your comments, feedback, and stories are very interesting and very important to us. So please share them in the comment section below, because we love reading them. Alright, so this is me, Amin.
And this Alex.
Catch you guys later. Bye.
Bye.